Welcome to episode 23 of America in Crisis, Breaking the Cycle of Addiction. My name is David Hunt, and I am your host. Please set your DVRs to record. This show could save your child's life. Today's guest is Middlesex District Attorney Marian Ryan. Marian was a past guest on one of our earliest shows back in January 2019. And with all the new developments in the opioid epidemic, I decided to bring Marian back to update us. Marian graduated from Emmanuel College in 1976 and Boston College School of Law in 1979. Marian began her career in the Middlesex DA's office immediately after obtaining her law degree. She served in multiple leadership roles, including Chief of Domestic Violence Unit and the Chief of Elder and Disabled Unit. Marian, welcome back to the show.
Thank you. Thanks for having me again.
Okay. A lot's happened since you've been here last. You last appeared in 2019. How are we doing in terms of overdose deaths since your last visit?
Well, probably the most significant, obviously, has been the last 6 or 7 months that we've spent in quarantine. And that's required us to be very nimble in terms of taking all of our programs and our offerings and being able to offer them virtually to people during this time when people are experiencing a lot of economic turmoil, a lot of loneliness, all of those pieces.
And how have the numbers been affected compared to last year since then? Do we have more cases, less cases as far as overdoses?
We are right now roughly where we were last year at this time, but what we are seeing is more cases where people are using alcohol or drugs often to take their own life. It's a more purposeful overdose.
And what can you tell our viewers about the task force that you've started?
So back in 2013, as we first began to tackle this scourge in Middlesex County, given the size of Middlesex County, we're very large geographically, 877 square miles, 54 cities and towns, as well as 21 colleges and universities, to both bring together stakeholders to talk about the things that we had in common, to avoid the duplication of efforts, and to really look critically at what was being successful and what was not. We began a series of task forces. We seated all of those task forces in the hospital, both to drive home the message that this was a public health as well as a law enforcement crisis, and also to give us better access to the medical experts. So in non-COVID times, we meet 5 times a month in different hospitals. Since April, when we really realized this was going to be a little longer than we thought, and we knew people were having a lot of needs because of their isolation, we have come together to do a virtual task force once a month.
And can you tell our viewers who would sit on this task force as far as what type of organizations make the task force up?
So it's all of the stakeholders in this issue. It's law enforcement, it's first responders, it's legislators, it's service providers, hospitals, child care providers, folks from the jail. Everybody who's going to be touching people who are suffering from substance use disorder comes to the table to talk about where we are.
And why is it so important to share this information between the different agencies? You all come together once a month. What is so critical about getting everybody in that room together?
Well, it helps us to, number one, to identify what's a common issue and how can we tackle it. You know, just the usual strength in numbers and bringing together some of the best minds that we have on those issues to figure that out. It lets us look at what other people are doing. So somebody at one end of the county may be doing something that's very innovative. We want to make sure everybody knows about that. And it also allows us to do some regional work so that every single city and town isn't doing the exact same thing.
I've actually sat on your task force for the last couple of years representing the EMS industry for the ambulance and for the first responders. And it's so good to be able to share because it's not a one-size-fits-all. You have a large city such as Lowell, such as Boston area, something large. That might work for us, but it's not going to work down Cape on a small island. And just the information that we share, like, I never thought of that. Let's give it a try. So we do get a lot out of these meetings. Now, you're pretty big on treatment over punishment. What does that actually mean?
Well, it always has to be a balance. Our first charge is the protection of the public safety. So we always have to have that in our mind. But the other piece is, I've been a prosecutor long enough to know that the traditional model of just moving people through the criminal justice system time after time, and they come out and if they've been incarcerated, they come out or they get off probation, and in a very short time, they're back in the same kind of situation. That's not really successful. And we know that a very large amount of criminal behavior is driven by substance use. So the question is, how can we actually make a change? Keeping in mind, we also have to have accountability. But how can we actually make a change for this individual, both to improve the quality of their life and to help them move away from that criminal behavior, which makes it better for all of us?
Now, these programs, obviously, a lot of them are through the police departments, and they do a fantastic job at them, especially, Gloucester started years ago, the Angel program, which was you could walk into the station and say, listen, I need help. I have some drugs on me. I don't have a trunk full of heroin, but I have a little bit of recreational. I'm afraid. Can I talk to you? Am I going to go to jail? What would the response be if I walked in to say Woburn Stoneham and say, listen, I'm using drugs. I need help. What would you do for me?
We're very fortunate to have police departments who really have adopted that service-oriented policing. So they're going to be looking to figure out how can we get help. Many of our departments employ clinicians, have family outreach. So we are really looking to get to the root of the problem, get people to help their family in terms of dealing with that.
I know Woburn is fortunate. We've had Vinnie Pirro, who started the HEAT program many, many years ago. He was a guest of our show. We've got Rick Jolly, our substance officer, who was also a guest. And we're so fortunate living in Woburn, but unfortunately, some of the other towns just don't have those resources. What other programs we offer in Middlesex? Can you name a couple of the programs people can go to that are out there specifically?
Sure, I can talk about a couple of things, and then also, given the time that we're in and people's increased need for program, we've created a dedicated section on our website that gives you a list of programs depending on where you are. It's interesting, we have talked a lot about what the bad effects of the pandemic have been, but one of the really good effects, and one of the things we're going to be looking to continue when we get back to normal, is I mentioned the distance and the size of our county. Often transportation's an issue. So for lots of people, we would have great programs someplace and they just would not be able to get there. Either they didn't have transportation or they didn't have the funds to access that. But everyone going virtually has done a great job in terms of putting those programs online. So if you're in Middlesex County, for instance, pretty much every day of the week, you could get to a virtual meeting of some sort. So we offer, in terms of the court process and people who get involved criminally, we offer a pretrial diversion program for both juveniles and adults. It was really born out of a situation we saw all too often, which was you would have a 20-something person struggling with an addiction. Often the sort of behavior that often goes with addiction had caused them to be sent out of their parents' home. They ended up living with their grandparents. Because of the addiction piece, suddenly we had grandparents who were maybe being physically assaulted, maybe having their financial resources taken. And yet, so they're afraid in their own home, and yet they don't want to prosecute their grandchild. What they really want is to have that person get help. So we created a program where we're looking to get people at the earlier end of their addiction. If they agree to go to one of the treatment programs that we've contracted with, they agree to complete that treatment program, whatever the program, we don't get involved in the treatment piece, whatever the program says they need to do. If they do that and they complete that, we don't go forward with those criminal charges. So it does a lot of things. It takes the burden off the grandparents of I'm the one moving forward, because if their grandchild goes into the program, then they don't do well, then it's our office moving forward against that person. It gets, hopefully, the person who's in treatment to a different place, and it also protects those grandparents or caretakers, because nobody should be living in fear in their own house.
So I can make a mistake, made a bad choice one time, maybe peer pressure at a party, got caught, and if it gets busted and gets arrested and there I am, I have an option rather than go to jail?
Right. And for people at the other end, people who may have had lots of encounters with the criminal justice system, are much deeper in their addiction, we have across the county 6 drug courts. That's a much more substantial program. It's a difficult program to complete, takes about 2 years. It's a 4-phased program. People work their way through the phases. The benefit of it is they have very intense supervision, particularly at the beginning, and supervision by the same people. We know that one of the things that people with a substance use disorder become very adept at is being able to sort of shade things a little bit, come away from their responsibilities. When they're able to go to court and they're seeing a different judge all the time, there's a lot of, I tried to get into the program, something happened, I couldn't go, the person didn't answer the phone, all of that. Drug court has a really dedicated team of professionals that are the same, and they're working with those people. So they know if you went to the program. They know if you should have showed up. So there's much more accountability for people. And for people who make it through that program, the results are really good in terms of not seeing them back again.
And I realize for the last 7 years or so, you've been doing this. And one of your programs is like the model across the country for this. Can you share that with us?
We've really gotten a lot of recognition, and it really is due to the stakeholders who've been willing to partner with us. One of the things that we focused on very early on was looking at the trauma for kids. What we continued to see is there were kids who were often present when there was an overdose that happened, fatal or non-fatal. And so when you look at what that means for kids, it may often mean them being disrupted. We look at what the research shows us about the link between genetics and addiction. There's a lot of need for intervention there. So we partnered with a number of mental health providers across the county so that our police officers are trained now when they respond to an overdose and there either physically is a child there or it's clear that a child is going to be dealing with that. The overdose happens at 10 o'clock in the morning. The kids may be at school, but they're going to be coming back. In addition to filing a 51A protective report with the Department of Children and Families, they make a call to one of our clinicians. And within 24 hours, those clinicians have put together an age-appropriate mental health plan for those children. So instead of someone saying you really should get help for the kids, they're able to say you should call this social worker at 3 o'clock tomorrow and help us make that connection.
Nowadays, with everything that's going on with good and bad publicity for everybody, if I'm with my friend and we're both over 18, so we're adults, and my friend is overdosing, should I hightail it out of there, or should I stay with him and call 911? Do I have to worry, oh my God, I just did drugs, needles hanging out of my arm, what if the police see me? Do I have anything to worry about as the guy that called it in?
If you are a person who either overdoses yourself or is with somebody else, what we're concerned about is saving people's lives.
Okay.
So Massachusetts provides now that if you make that call for life-saving treatment, you don't leave the person in the alley or wherever you are, you will not be prosecuted for that possessory offense.
Well, that's good to know again. And I'm telling you this as an EMT, a first responder. If your friend or anybody is having an overdose, like the district attorney just said, you don't have to worry about going to jail. Make the call, stay with the person. If you had some first aid training, make sure the airway is open, make sure they're not vomiting and choking to death. Do what you can. You don't have to worry about, I'll leave the guy because I was in the same party doing drugs. Now I'm glad you cleared that up for people because people don't know what to think anymore. It's like, should I be there or should I just take off and let somebody else find them? And that's just horrible that people don't know what to do, especially if you're high yourself and you don't know, should I leave them? Should I go? Do I want to be with them? Am I going to get asked 20 questions? What happened? So remember, always render aid. You're not going to get in any trouble for rendering aid. So nowadays, let's bring up another subject, COVID and stress. We had the people from NAMI here a couple of weeks ago. Mm-hmm. We had sad OD. Stress is out there. Everybody's life has changed. So why more people, obviously we know the answer, more people are turning to drugs. What's happening here because of COVID? They just can't deal with reality anymore? I mean, it's stressing the hell out of me.
Well,
I'll be the person, my life's upside down, I'm sorry, you know what I do.
What we're seeing is, and this is not at all confined to this county, really across the country, the research is showing us now that about 40% of adults are reporting some kind of upset to their mental health as a result of the pandemic. whether it's the stress of having lost a job, some other economic situation, whether it's, kids are home, life is disrupted, whatever it is. And not surprisingly, people often turn to substances, and that includes alcohol as well as illegal substances, to ease that stress. In Massachusetts, alcohol sales are up by about 27%. You might remember that early on in the pandemic, one of the stores that was open were stores selling alcohol, so there was a lot of access to that. And, for somebody who's already struggling, and particularly somebody who's been struggling with substance use disorder and may have developed respiratory or heart issues, that can all be a very dangerous combination.
I want to throw a term out there and you can explain to our viewers what it means. What's the term death by despair mean?
Death by despair is a death through the use of a substance, alcohol or some other substance, that is really driven by socioeconomic forces. So I may overdose on alcohol or drugs. My issue is not necessarily that I suffer from a use disorder, but that I feel overwhelmed and completely depressed by whatever the socioeconomic things are. Either I'm completely isolated, maybe my romantic partnership has broken up because of the pandemic, I've lost my job, I just feel like I've lost my house, I feel like I can't get back on my feet.
Okay, now I understand that according to the CDC that a quarter of the people between 18 and 24 have actually thought about suicide.
The numbers of people taking their own life intentionally are up pretty dramatically. And even before the pandemic, we had seen a very concerning increase here in Middlesex County. And that, unfortunately, that has continued. And it's really across all gender, age, socioeconomic barriers. We're seeing it being 70-year-old people, we're seeing it being 19-year-old people. One of the things of particular concern is the number of women taking their own life has gone up dramatically.
Now, what can you comment on the report that 10% of the population is actually considered suicide within the last 30 days?
Well,
that number's staggering, I'm sorry.
The number is huge, and it really has led us, even before the pandemic, to start taking some steps about that. We've begun doing a lot of training in the QPR program, which is Question, Persuade, Refer. And it's a program that's kind of like CPR in the same way that anybody can learn CPR relatively easily and be available if you're in a restaurant, you're on a train, whatever, and somebody's experiencing some kind of event that causes them not to breathe, you can jump in and save them. QPR is very similar. It takes people who are not mental health professionals, just gives them knowledge about what are signs that are really concerning, as opposed to someone saying, oh, I just can't stand this. I don't want to, that kind of expression of sort of, you might pass off lightly. What are the things to really be looking at? If you are concerned about somebody, so you've applied that question of are they showing concerning symptoms? Yes, they are. Then trying to talk with them, how to persuade them to try to make some very small commitment as to their own safety. Do you promise that are you feeling like you're going to hurt yourself? Do you promise that you will come with me tomorrow and you won't do anything in between that? Kind of persuading them in that sense, and then making a referral to somebody who is a trained mental health professional. So we've done a lot of training for our law enforcement partners, for people who are interacting with the public. So for instance, we did a training with office staff at the State House. Okay. Very often people come to the State House. They are there because they have what seems to be a problem that they just can't untangle. Maybe it's a financial problem, a problem with their housing, problems with their kids. And they present as being, they've been to 15 different offices. It seems that no one can help them. They can't understand how they got to figure that out. They're very upset. So we trained that staff to try to really figure out how do you separate somebody who's appropriately frustrated from somebody who's really at risk, and how to make those referrals.
Plus, life's being changed upside down anyway. I mean, I'm a person, I used to do public service events, 30-something of them a year. I loved going out with the people, meeting people at the events. That's all over with. Simple Things, Festival on the Common, the Relay for Life, all that's been canceled and virtual. It's horrible. So now you come home, you're stressed, you don't get to meet all your friends and unstressed. You can only do so many Zoom calls a day. It's tough, and now...
Zoom calls are stressful.
Yeah, I'll believe me.
Sitting in a Zoom call all day, that's hard for people.
So the younger kids don't know what to do. They'll start alcohol, some start on drugs because they just need to... That seems like the best solution to get them in a better mood, unfortunately. Now, many of the guests of our show have been speakers at your task force. Why is it so important that the people at your task force, their message get out to the public? And before you answer, I'm just going to say, the reason I do these shows is I feel their message, I sit in on the meetings, there are 3 or 4 speakers a day at these meetings, and their message to me is great for the first responders, great for the police, great for the fire, great for the law enforcement, but it needs to hit the public. So why do you think these people coming on this show, it's so important that their message gets out to the public that need it?
Well, you're right. I mean, we do really good work here across the county. I think that our programs around substance use disorder have really won national recognition. We have seen, and keeping in mind that even one person losing their life is too many, but we have seen a really pretty dramatic decline in our substance use disorder deaths here in this county, and it really is because of these partnerships. But information isn't useful unless people know about it. So that's why we post it, we come on shows to talk about this. We invite very large crowds of folks to our task force meetings because the more information it gets out, hopefully they share it with somebody else, and it just kind of makes its way through the communities.
Now, I know no one's going to believe this, but I understand funeral homes are now stocking Narcan. Why would a funeral home need Narcan?
So we began providing some Narcan, and for people who don't know, Narcan is really that life-saving drug which, if administered in a very short window after there's been an overdose of an opioid, has a pretty miraculous effect in reviving people. And we have made Narcan available to lots of different places, any place that people might go that they would be suffering an overdose. So we provide Narcan to schools, we provide it to shelters, soup kitchens, any libraries, public libraries. A lot of people go to the public library, they may make their way to the restroom, they experience an overdose because the window in which it's effective is pretty short. So if you're reaching out to a first responder, police, or fire, obviously it takes them a certain amount of time to suit up and get to where you are. That can be valuable time that's lost. One of the places that we started to hear that people were experiencing overdoses was at funeral homes, and the scenario would go like this. Someone would have lost their life because of an overdose. Funeral home is providing services to the family. Friends and relatives in the days when you could go there were coming, and not unusually, some of the friends and relatives might also have some substance use issues themselves. They are upset, obviously, by the death of their friend or family member and might use to help them through that problem. So you'd have somebody come to a funeral home, attend a wake or some other kind of services, maybe go downstairs, be in the restroom, and experience an overdose themselves. So this is one of the things that we were able to do through the task force when we became aware of that problem. So any funeral home who wants it will provide them with some doses of Narcan. They have it right there. It is relatively easy to use, pretty easy to learn how to use it.
So any funeral home listening to this can just pick up the phone, call your office, and you can provide the Narcan to them.
We'll make it available to them, yeah.
I also know that you have a program for training. I'm one of your train the trainers.
Yep.
And it's very easy to use. You can contact the DA if you want to know how to use it. And you can even send me out to do it. I'm trained in how to administer Narcan and how to teach it. It can be done literally in 10, 15 minutes. How do you feel that bringing all these people together, it's changed? What difference has this made? You've got the police, the fire, and everybody. Obviously, you've seen the numbers go down. Why is it making a difference?
I think it's making a difference for a couple of reasons. One of which is people are busy every day, and everybody tends to work sort of in their own little area.
Okay.
And I think this coming together has helped us to see how much commonality there is around this issue and how we can really help each other. So I think there's that piece. All of a sudden you have the police talking to DCF about how can we help a family. You have people that may be in custody the jail already reaching out to service programs so that when they come out, there's sort of a warm handoff, a seamless transition. So I think there's been a lot of connectivity that way. We work very hard to bring sort of the newest research, really the cutting edge thoughts on these issues to the task force. So we very early on have the benefit of things. So for instance, one of the things that we presented at our task force probably a year and a half ago now was a lot of the research that's being done here in Massachusetts with some startups about how you can actually test the water in sewers to identify clusters of people who may be experiencing substance use disorders. So it's not identifiable to any particular person. I can't trace it back to your house. But for instance, if I suspect that in a particular neighborhood there's an extraordinary use of some substance, by testing the water in the sewers, I can figure that out. Is there something? Is that a place where we need to focus treatment? And the equipment is actually so sophisticated, it can tell the difference whether it is a substance that somebody has used and has passed through their body, or I've taken a bottle of unused medication, which you shouldn't be doing, but I threw that down the toilet to get rid of it. So that's some research that we heard about a very long time ago, and you might remember that a few months ago, early in the pandemic, it was also useful for cities and towns around where there might be going to be an outbreak of COVID, because they're able to track those same kind of antibodies in the wastewater.
That was a good point about dumping your unused drugs down the sewer. I think episode 15, 16, we had Frank from the Mass College of Pharmacy along with Mackenzie, and they had actually donated to my organization. I think it was 100 bags that we gave out at one of the groups, so they brought them to the show. We put it out there, and many members of the city of Woburn were able to come pick up a free drug disposal bag. They could get rid of their bag in their household trash because it became inert. And for people that are interested in something like this, you can get them at Walgreens, CVS, even on Amazon. It's a drug disposal bag. You just take your unused medication, you throw it in there, put some water, mix it up, and in 30 seconds it's safe to throw in the trash. That's a kid found it, that drug has become inert. Because you never ever want to flush a drug down the toilet. You might have happy fish, but it makes a mess on the system. So we don't want that. So question for you. Why is it so important that people that have a kid that's got a substance problem is suspected that that family knows how to use Narcan, actually has Narcan? Knowing how to use it and not having it isn't going to do anything.
Right. Because it really does. Obviously, no one wants to find this problem in their family. If you do, you want to be seeking treatment. But the reality is that until that treatment has taken hold, and even then, there are often relapses, the opportunity for families to be able to revive somebody really is tied to Narcan. So I'll give you an easy example. When there is an unattended death, so for instance, a death that occurs by an overdose in a family home, the troopers from our office respond. And we continue to hear this scenario, which was, I was at home with my son, daughter, who's been experiencing substance use disorder. At some point, I discovered them not responsive. So they're always asked, as we try to get a timeline, when did they come home? When did you last see them? That sort of thing. What we continued to hear was, maybe I found them at 11 o'clock, but I know they were fine at 8 because I heard them snoring. And we saw that often enough that it was clear that there was a connection. What we were able to learn from our medical professionals is that what they thought was snoring that they were hearing was actually not snoring. It was actually the distressed breathing of the onset of an overdose. And so we took that message and we really went very public. Many of the TV stations were helpful. We got that message out there. If you are living with someone with a substance use disorder and you hear that very deep, ragged kind of snoring, you need to do two things. You need to try to wake them up. You need to use Narcan if that's appropriate, and you need to dial 911. You often can't measure prevention, but once we began putting that message out, what we saw was a very dramatic decline in fatal overdoses in those situations. We continue to see non-fatal overdoses where a family member would say, I heard the snoring, I intervened, in effect, I prevented it from becoming fatal. So that's something that's relatively simple. Really, anybody can do that. It's just important that people know that message.
And can you share with our viewers where they can pick up Narcan? Do they need prescriptions anymore, or where can they go out and buy Narcan?
There's a standing order for Narcan, so you can get Narcan at your local pharmacy, all the chain pharmacies, the CVS's, the Walgreens, all of that. You don't need any prescription. What you pay for it will vary depending on what your insurance and your copay situation is. No one should do without Narcan because of money, because there are lots and lots of programs that will make it available to people for free. So for instance, the Learn to Cope program, lots of other treatment programs will provide that to people for free. So, and we do have, my office along with several legislators is sponsoring a piece of legislation which would require that anybody who manufactures and or sells opioid products in Massachusetts, it would require them to make a tiny donation of money that would create a trust fund to dramatically decrease the copay around Narcan, modeled on what they do in New York.
That seems amazing. If you need the product now, you can get it. And I urge anybody, if your son, daughter, anyone in your house has an opioid problem, have the Narcan. It's like, you don't know when it's like the saying for mace, it's better to have it and not need it than need it and not have it. You want it there in case the absolute worst comes. Can you give us a quick update on the youth and adult diversion program? Why don't you just touch on that for a couple of seconds?
Sure.
How's it working?
So we run a very robust diversion program, both for people who are juveniles, which is Massachusetts is anybody under the age of 18. We also do a diversion program for young adults that has an upward age of 26, although we're somewhat flexible about that. The idea is we know that getting a criminal record has an enormous implications in terms of going forward, whether people can get financial aid, whether they can get into school, buy a house, get a job, all of those things. So our goal is twofold, both to hold people accountable for their conduct and to prevent them from getting that criminal record. So there are a number of non-violent offenses where we have somebody who takes responsibility for what they've done. Then we have a set of conditions aimed at addressing whatever their issue is, whether it's a mental health issue, a substance issue, and we have them doing some type of service in the program, whether it's at a program like More Than Words, a bookstore program. There are a number of things. We try to tailor that to people's interests, because obviously people do better when they're involved in a program that they're actually interested in, that they're going to show up for. And if they complete the terms of that contract, we then do not go forward with that criminal case and avoid that criminal record.
Can you tell us how Senator Jason Lewis was instrumental on your task force in starting this?
Sure. Senator Lewis was a great partner in helping, as has been a number of legislators around the county, in helping us to set up the task force at their hospital. So Senator Lewis was very helpful in us setting up the task force that pre-COVID met at the Lawrence Memorial Hospital.
And what role does Melrose Wakefield play in all of this?
And Melrose Wakefield is a wonderful partner. They're a wonderful partner both in, they host a task force and also partner with us on a number of initiatives, especially around safety of kids.
Okay, we've already touched upon Project CARE, of course, so you gave us a good description there. Okay, I understand we're looking to a new addition to your staff, something I'm already madly in love with. No, I'm not stalking her staff. This is an example. This is not the actual one. This one I may have been in love with. But what can you tell us about your new addition, when it's coming, and what it's going to be there for?
So, as I mentioned before, one of the things that we, for the last 7 years, have really taken a focus on is trauma. You know, there are the events that take place, but then there's the trauma that's associated with that, which often can be as debilitating as the effects of the act that happens. So both for people who come to our office who have been victimized, who might be being witnesses, we know that itself is traumatic, as well as the folks that work in our office. They respond to scenes that are very traumatic. They spend much of their time interviewing and talking with people who've had a traumatic experience. So we really want to do anything we can to help protect that issue, that mental health of both the people coming in to work with us on cases as well as our own staff. So we are going to be adding a trauma dog who's an English lab. They are trained to be helpful. The research, as many of you know, research shows that just petting a dog, being around a dog, just calms everybody down, just helps to improve the environment. So we have a puppy that's going to be joining us around Christmas time.
Oh, you do know I'm taking that home some night, don't you?
Yes, yeah. We're looking forward to it.
I have to do a lot of visiting to Megan. I'm only there for the puppy, don't worry. No restraining orders. Okay, Marion, I'll give the floor to you. What would you like to leave our viewers with? The floor is yours.
I think that one of the most difficult things for people with either with substance use disorder or the people who love them is this is by definition a disease where relapse happens, but recovery is very possible. And in Middlesex County, the partnerships that we have built really should give people a great deal of hope about their ability to access treatment, their ability to access life-saving interventions such as the Narcan, and to find in the stakeholders around these issues, whether it's at the police department, the first responders, whoever, people who really are committed to making our community better and to helping people recover. We talk a lot about the people who overdose because that's how we measure sort of where we are and how we're doing. The story that also people need to keep in mind is of those people who take advantage of that treatment, who are able to put their life back on track and be very successful.
Very well put. Now, before we close, I'd like to speak to our audience for a couple of minutes. This is a mask. This is not a political statement. This is not an American thing, an Italian thing, an Irish thing. It's not a Catholic thing. It's not a Protestant thing. It's not a straight thing. It's not a gay thing. It is a mask. It is not a black thing. It is not a white thing. This is actually a blue thing, if you want to be technical. Why am I bringing this up? Because with all the controversy we've been hearing, with people catching it, catching COVID, and people saying, oh, it doesn't make a difference. Let's just say this. Let's just for a minute assume that Dr. Fauci, CDC, and every trained health organization is wrong, and this isn't going to help you. What harm have you done by putting this on your face? Both all the experts are totally wrong with all their research. You haven't done anything to hurt yourself. But if they are right, if just one of them is right, and you can stop this disease, this mask will stop bad air from coming in and bad air from coming out. It breaks the cycle. You do not bring the disease home to your family. You do not bring it home to mom and dad, grandma and grandpa. So let's just take the word for the trained professionals. If you don't believe them, you don't believe me, put it on anyway. You're not going to hurt yourself, but just think of the lives you can save. Massachusetts has just surpassed 9,300 deaths from COVID. The United States has hit over I think it's 1 million people. Am I right on that? We've hit, it's either the world or we've hit the million. We've hit a million mark for people with COVID. It is not worth taking the chance. Let's just believe the health professionals, and if every one of them is wrong, you haven't hurt yourself. The life you save could be that of your others, your family, your friend, and other people. Why am I bringing it up? Because this whole show is to save lives, whether it's opioid epidemic, overdoses on drugs, overdoses on alcohol. We're here to save lives. That's why I do this show. And when something as simple as a small 15-cent piece of cloth can save a life, please, just work with me on this. Let's save the lives of the people that you love. I thank you, of course, for listening. And I would like to thank our guest, Middlesex District Attorney Marion Ryan, for appearing today. As always, thank you for watching. Please share this program with your social media friends. If you or someone you know is suffering from a substance abuse disorder, you can contact the Massachusetts Substance Use Helpline at toll-free 1-800-327-5050. The show can be seen on a rotating basis on Woburn Public Media stations and on demand at their website and, of course, on YouTube. As always, thank you and the wonderful staff of Woburn Public Media for making this show possible. Please enjoy our closing theme, Rise Above the Noise, by our former guest, Fireheart, through the credits from Put in Contact Information. For America in Crisis, Breaking the Cycle of Addiction, my name is David Hunt. And also, if you're wondering what Fireheart is and what Rise Above the Noise is, there's a video on YouTube. It's about 3.5 minutes. Search it under YouTube, Fireheart, Rise Above the Noise. You see a story of a wonderful young lady. You'll know what the music means. And of course, thank you for watching. We have some amazing guests coming into the studio. And again, thank you for the amazing staff for working with me and letting me make this possible.
Those you judge might never die. Above the noise, you hear us cry. There are people who care. Listen to the sound if you dare. Rise above the noise in the air. The sound not heard is what we bear. Listen to the sound if you dare. Rise above the noise in the air. The sound not heard is what we bear. The whispers that I hear behind my back are those who never lost a child.